Good afternoon. Hi, everyone. Today I will present a little bit about clinical prediction models. So I'm Tuur Leeuwenberg, and I'm working on this topic together with my colleague Ewout Schuit. And my background is a bit in statistics and methodology. So just as a sort of disclaimer, I have no medical training in that sense. And the topic of today is to talk about clinical prediction models. So I'm starting off with what do we mean with this? So all over medicine, there's a lot of clinical prediction models being used actually. And what we mean with that is, the prediction is to foresee or estimate the probability of something that is yet unknown. And that can be, for example, diagnostic. So that means that you want to predict something about a patient, for example, based on certain characteristics at the very moment. So you might want to predict a diagnosis based on certain characteristics, so that you maybe don't have to do an invasive test. Only if there's a really high risk that someone has the diagnosis, then you would maybe want to double check it with an invasive or costly reference test. And the second kind of use is prognosis. So then the aim is of these models to predict an event in the future. So for example, risk of cardiovascular events like a heart attack, for example. And for this to do these predictions accurately, there's many prediction models are developed. And what is a prediction model? So prediction model really is estimates the probability of a certain health outcome. So for example, a cardiovascular event based on certain observed variables like maybe age or gender or whether you smoke or not. And there are many ways to do this modeling step, basically. And everyone every research team sometimes uses as a sort of favorite modeling tools. One of the common modeling tools are generalized linear models, which are very common. But there's really a huge amount of models that can be used, and it depends exactly on the setting, what is most appropriate to use, or what gives the best predictions. And just to give a little bit of an idea how this modeling process usually goes. So one perspective to look at it is that there are all the possible models that you can make. And then some of them are useful, meaning that they are good enough to be used in practice, that they are actually helpful. And what you want to do during this modeling is to get a useful model. And this is often a combination of making the right assumptions and having the right data. And then if you combine those, you can find those models, or you hope that most models that you find are useful then. So it's really important here to know a lot about the thing that you are predicting. So how cardiovascular risk works, what are important factors to consider there. But on the other hand, you also, because if you make the wrong modeling assumptions, then it could be that you end up, that you don't end up with a useful model. And the same goes for the data here. So if you need to have good representative data of the modeling problem that you are looking at. Otherwise, you may also not end up with a useful model. And one of the assumptions that is basically almost always assumed is the IID assumption. So this sounds very complicated, but what it really means is that if you want to make a model, let's say for all Europeans, that predicts a certain prognosis for all Europeans, then and you take and you use data from 13 European hospitals to develop this model, then it's really important that that these patients in this data that you're using are representative of the target population, so that they are representative of Europeans in which you want to use the model.
If I may, so IID stands for?
It stands for independently and identically distributed. So what that means is that independently part, that means that the data of one patient does not depend on other patients, which is kind of, you can immediately see that that is the case. Yeah, you don't, But, and the identically distributed part, the second I of the IID, is that the sample or the data that you use to develop the model is identically distributed as the data or as the patients for which you want to apply the model. So that means that it really has to be representative, otherwise it is not identically distributed.
So for example, if the sample is a population based in Iceland only, where all people are genetically connected, they are not independent, and then they cannot be representative of a larger European population. Is this what you mean?
If you would only, if probably Iceland has certain different average age from the rest of Europe, and then that could already be. I'm not sure about Iceland how it would be, but let's assume they are older compared to the rest of Europe on average. That means that maybe if you would apply the model to an average other European person, it would know. Yeah, it would be a bit biased towards older population. So that's why you want to have ideally you would want to have a random sample from your target population. So even if you develop a model in one country, you would want to have data from different locations in that country in different centers. So this is an example of a prediction model visualized here. So this is the SCORE model, and it can give you the 10-year risk of a fatal cardiovascular event. So, for example, here you can see that if you, let's assume you're a man and you are between 60 and 65 years old, and you have a certain cholesterol, which is here on the bottom. You can observe that, let's say it's you're in this group for the cholesterol level. Then you can read from this chart where what would be the probability of having a fatal cardiovascular event in the next 10 years, according to the model. So that's how you could read. So this is a fairly simple model, but it's quite usable because you can represent it immediately in a chart like this. And this can be then used in the clinic, for example. This is a quite commonly used model. So why would you want to use prediction models? So it's very important that they are really not intended to replace physicians, but really to inform them about patient risk for diagnosis or for prognosis. And the motivation is really to have objective probabilities regarding certain events, so that you can really make the right decision given accurate information about that. And the reasoning is that if you can make better, more informed decisions that are more objectively estimated, this improves the overall medical decision making process, and that helps the patient care, and in the end then also the patient. So why would you want to use them? Yeah, so for example, just some examples. So yeah, to decide whether you want to do a certain diagnostic test. So if which I mentioned before, if you have a certain test, but it's very, it comes with side effects, then you only want to do this test maybe if you already know that this patient has a fairly high risk of having a certain diagnosis, but you don't want to just screen the whole population with a very invasive test, for example. And another one is just to communicate about risk, so that if you come to a doctor and you have been diagnosed, then you would like to know what is likely going to happen to me, what is my prognosis. So that's another reason why you'd want to just have these models, so that you can actually get a picture of what are the risks, what is coming, basically. And this may also sometimes help in the decision-making process, so in treatment decisions. Another one or two other more technical uses in research are, for example, that you want to select certain patient populations that are already at high risk of a certain outcome, or if you want to, for example, compare different institutions on how well they do a certain surgical procedure, for example, you might need to correct for the severity of patients that are coming in. Because if one hospital always gets the very serious patients, then it will seem as if their surgery is not going so well, because many or more people have severe outcomes, but then you have to correct for the severity of the patients when they come in, compared to hospitals that have maybe less severe patients.
So for example, on the previous slide with this model, no, even the one before. If you want to convince someone to adhere to a lipid-lowering treatment or lifestyle measures to lower blood pressure, or to continue controlling cholesterol, you can compare the effect of low blood pressure or higher blood pressure and discuss which is the probability to die from a severe heart event in 10 years, or you can convince to keep smoking based on these models. So it's really the communication at the clinic.
Yeah.
The model help to explain the different risks of doing something or not doing it.
Yeah. Yes. Yeah. So that is a bit of sometimes with some models you can do that you look at what happens if I would have smoked compared to would not have smoked, but it's not always the case that you can do that. So sometimes it's only about what situation are you in at the moment, and for that we can have the risk, but it does not mean that if you then if you say that you are a smoker, and you cannot always then infer what would have been my risk if I had not smoked. Unfortunately, it doesn't always work like that, but you can have a risk estimate for the situation that you are in at the moment. Yeah. But sometimes you can do that. Yeah. Yeah, so there are really a lot of the prediction models being developed. As you can see, there's a lot of research published about this. So this is only, and I only used one term here, but if you, this is definitely not everything. But not everything is always of high quality, what is being developed. So this is just an example of a large systematic review that was performed during COVID, where they identified over 200 models, and they judge for each of the models based on the study design, what is their perceived quality. And then they really found that a lot of the models were had a high, what they call a high risk of or unclear risk of bias, so that you may not want to use them as they are in practice because of the way they are designed, so that there may be issues with them. Yeah, so that's really quite a bit of a problem in a way.